If you're over 60 and suffering from sciatica that keeps coming back, no matter how many stretches you do, the problem might not be your disc at all. It could be a simple mineral deficiency that's weakening your connective tissue and damaging your nerves. I'm Dr. Emily Carter, and today I'm going to reveal a connection between sciatica and a specific nutrient deficiency that most doctors never check. What you learn in the next 13 minutes could finally give you lasting relief instead of just temporary fixes. Before we dive in, I'd love to know where you're watching from today and what's your age. Drop your location and age in the comments below. It helps me create content that truly serves you. Let me start by explaining what sciatica actually is. Sciatica is a problem with the sciatic nerve, which is the longest and largest nerve in your body. If you look at the width of your thumb, that's usually the width of that nerve where it comes out, of your lower back and sacrum. There are 5 nerve roots that form this one sciatic nerve, and when we have a problem with that nerve, that's called sciatica. Now, there are wonderful stretches you can find that help sciatica temporarily, and I absolutely recommend doing them. But the problem is what happens later in the day or the next day when the pain comes right back. Today, we're going to talk about what we can do to actually correct this problem at the root cause. Here's what we know about sciatica. About 90% of the time, it involves the disc. The disc has an outer layer and an inner layer. The inside is like a jelly donut. When the outer part of that disc gets weakened, some of that gel can squeeze out and put pressure on the nerve roots that make up the sciatic nerve. Then you have pain either in your buttock or travelling down the back of your leg all the way to your foot or the outer part of your leg. Sometimes it's not just severe pain. It could be numbness, burning, or annoying, deep, irritating sensation. Now, here's where this gets interesting. I found a condition that fascinated me because I hadn't heard about it before, and it completely changed how I think about sciatica. The condition is called myeloneuropathy. That's M-Y-L-O myelo, which means the marrow of your spinal column composed of nerves that run up and down the spine. Neuropathy means some type of nerve damage. So myeloneuropathy is a combination of a problem in the spinal column and the peripheral nerves that come out of it. This condition causes all sorts of nerve problems, including burning, gnawing, numbness, severe pain, and even weakness in the muscles, because these nerves connect with muscles. But here's what really caught my attention. Myeloneuropathy is most often caused by a copper deficiency. It can also be caused by vitamin E or folate deficiency, but the majority of the time it's copper deficiency. So I started researching copper in relationship to the sciatic nerve, and I found some absolutely fascinating information that could change everything about how we treat sciatica. First, there are all sorts of therapies that use copper for inflammation and pain. Copper bracelets, copper patches, copper creams, and even braces that wrap around your upper hip area, covering the sciatic nerve origin that are laced with copper. A lot of people are reporting amazing results with these copper-based products. We don't know exactly why copper helps pain and inflammation when applied topically. Something could potentially be absorbed through the skin. But copper is also a very conductive metal, so maybe it does something with the electrical fields that are out of balance in the area of pain. There's not much research on this, but that doesn't mean it doesn't work. The amount of people reporting great relief from copper products is quite large. And I'm talking about skeptical people. I'm not going to wait for studies to prove it might work because it's a very low-risk, non-toxic, relatively inexpensive thing that anyone can try. Even in ancient Egyptian times, they used copper bracelets and copper jewellery for pain, inflammation, and arthritis. Interestingly, the Arthritis Foundation says there's no validity to using copper or magnetic bracelets. But as I've learned over the years, when certain organisations say not to do something, it often works very well simply because of who funds these organisations. Now that's using copper externally, but what about copper deficiency internally? What does that have to do with sciatica? It has to do with a lot. Copper is involved in quite a few different enzymes in your body. One of the most important enzymes uses copper as an essential coactor for building collagen and connective tissue. And guess what? Your disc is made of collagen. About 75% of the outer part of that disc is made from collagen. So if you're deficient in copper and therefore deficient in collagen, you can have a weakness within the disc itself. That weakness makes the disc more likely to bulge or herniate and press on the sciatic nerve. Copper is also used in enzymes that involve nerves, the nervous system, nerve transmission, and even myelin, which is the protective coating around nerves. A lot of things start lining up when you look at a copper deficiency and sciatic problems. Other people develop carpal tunnel syndrome when they have a copper deficiency as well. So copper is essential for collagen and connective tissue. I've done videos on collagen before, talking about how important vitamin C is in making collagen. But if you look at nature, copper is part of that vitamin C complex. They work together. We have copper for collagen and connective tissue. We also have copper for the nervous system. Certain parts of your brain have very high levels of copper, especially areas involved with dopamine. This is why there's usually a copper deficiency in people with Parkinson's disease, which involves dopamine. Dopamine is critical for the nerve-muscle connection. Copper is also involved in making energy, helping you sleep, making melanin, which prevents graying of hair, forming red blood cells, building bone, and acting as an antioxidant. As you can see, copper does a lot in your body. So how would someone become deficient in copper? There are many reasons. First, not getting enough copper in the diet. Copper is really high in shellfish and organ meats, which are two foods that most people don't consume regularly. Athletes are usually low in copper because physical exercise increases the demand for copper, especially at higher altitudes, because that strains the red blood cells. If an athlete is working out intensely and not eating right, they can develop a copper deficiency and end up with weakness in connective tissue, collagen, tendons, ligaments, muscles, and discs. Taking a lot of zinc without the opposing mineral copper can create a copper deficiency. Taking a lot of iron can deplete copper. Enriched flour products like breads and pasta can deplete copper. Fluoride from tap water definitely depletes copper. Too much vitamin C, mainly in the form of ascorbic acid supplements, can deplete copper. If someone is taking 2, 3, or 4 grams of ascorbic acid daily, that's going to deplete copper. A lot of sweating can deplete copper because it comes out through sweat. Too much suntanning can deplete copper because of the connection with melanin production. Stress and high cortisol levels deplete copper. Even taking too much potassium without trace minerals, like copper, can worsen the deficiency. Distilled water creates a deficiency of all minerals, including copper, unless you add them back in. High levels of niacin can deplete copper to a certain degree. Gastric bypass surgery tends to create deficiencies in copper and other trace minerals. Eating too much sugar, drinking too much coffee or alcohol, and consuming artificial sweeteners like aspartame can all deplete copper. But I think there's one additional thing that's very important. People who have sciatica may also have a genetic issue with copper absorption, creating a deficiency even though they're consuming normal amounts. This is related to DNA polymorphisms, which are mutations or errors in genes that can leave you deficient in certain nutrients. I found 2 different genes that if you have problems with them, you'll most likely have a copper deficiency. Studies associate this with a higher level of getting carpal tunnel syndrome and compression fractures because copper is involved in bone formation, since part of your bone is made of collagen. All this is very interesting, but what can you do about it? You have 3 practical options. Option number 1 is to try a copper brace. Do a search online to find copper braces designed for sciatica. These look like they support the hip, but wrap around the area right where the sciatic nerve comes out in the upper thigh, and they're lined with copper. This might give you temporary relief. There are also copper patches and copper creams available that many people find helpful. Option number 2 is to make sure you're getting enough copper from food. The foods highest in copper are beef liver or any liver, oysters, shellfish, dark chocolate without sugar, cashews, and grass-fed beef. These are the best natural sources to increase your copper intake through diet. Option number 3 is copper supplementation. This is important because you can actually correct the deficiency. And if by chance you have a genetic weakness affecting copper absorption, your going to need more than just the bare minimum amount. Here's what I recommend. Start with 2 milligrams of copper per day and slowly increase that over a period of 1 month to 20 milligrams. Increase gradually every several days, taking a little bit more until you reach 20 milligrams. You might need these higher amounts to make the necessary change for your disc to start healing and your nervous system to start repairing itself. After 1 month at 20 mg, you can experiment with reducing the dosage and see how you feel. If you do well, stay at a lower amount. If symptoms get worse, take a little bit more. Over a period of maybe 3 or 4 months, try weaning down to about 2 mg a day and see if that's all you need for maintenance. The point is to give your body enough copper to rebuild the collagen in your disc and repair the nerve damage. Then find the maintenance dose that keeps you feeling good. Now, I want to be clear about something important. This copper connection doesn't invalidate the necessity of doing stretches for sciatica. You should still do stretches to relieve immediate pressure and maintain flexibility. But if you don't address the underlying copper deficiency, you're just treating symptoms temporarily instead of fixing the root cause. The stretches give you relief today. The copper gives you healing for tomorrow and prevents it from coming back. Let me explain why this matters so much for people over 60. As we age, our ability to absorb nutrients decreases. Our digestive system produces less stomach acid, which is needed to absorb minerals like copper. Many seniors are on medications that further interfere with mineral absorption. We're also more likely to have been depleted over decades of stress, poor diet, or medication use. And we're more likely to have age-related disc degeneration, which makes the copper deficiency even more problematic, because we need that copper to maintain whatever collagen we have left in those discs. Think about it this way. If your disc is like a tire and the outer layer is weakening because you don't have enough collagen, no amount of stretching is going to fix that tire. You need to rebuild the structure. Copper does that by supporting collagen production. At the same time, if your nerves are damaged from copper deficiency, they're going to be more sensitive and more likely to send pain signals even from minor compression. Copper helps repair that nerve damage and strengthen the myelin coating that protects your nerves. This is why I'm so excited about this connection. It's not just about temporary pain relief. It's about actually healing the underlying problem. I've seen patients who've suffered with sciatica for years, trying every stretch, every therapy, every medication, and nothing gave them lasting relief. Then they addressed their copper deficiency, and within weeks to months, their sciatica improved dramatically or disappeared completely. Their discs were finally getting the building blocks they needed to repair themselves. One more thing I want to mention. If you decide to supplement with copper, make sure you're also getting adequate amounts of other minerals, especially zinc, because these minerals need to be in balance. A good quality multi-mineral supplement can help, or you can take copper and zinc together in the right ratios. Generally, the ratio should be about 1 part copper to 10 parts zinc for maintenance. But when you're correcting a deficiency, you might need more copper temporarily, as I outlined. Also, pay attention to how you feel as you increase the copper. Some people might experience minor digestive upset if they take too much too quickly. That's why I recommend the gradual increase. If you experience any unusual symptoms, reduce the dose and increase more slowly. And of course, if you have any health conditions or take medications, check with your healthcare provider before starting copper supplementation, especially at higher doses. Here's your action plan. First, evaluate your risk for copper deficiency. Are you eating liver, shellfish, or other copper-rich foods regularly? Are you taking high doses of zinc, iron, or vitamin C that could be depleting copper? Do you have any of the risk factors I mentioned? Second, consider trying a copper brace or patch for immediate relief while you work on the underlying deficiency. Third, increase copper-rich foods in your diet. Fourth, consider copper supplementation starting at 2 milligrams and building up to 20 milligrams over 1 month as I described. Fifth, continue doing your sciatica stretches while you address the nutritional component. And sixth, give it time. Collagen rebuilding and nerve repair don't happen overnight. You need at least several weeks to a few months to see the full benefits. If you found this information helpful, please give this video a thumbs up and share it with someone over 60 who's struggling with sciatica. Subscribe to Dr. Emily Carter for more evidence-based health tips designed specifically for those over 60. Have you tried copper for sciatica or nerve pain? Drop a comment below. I read everyone and love hearing about your experiences. Until next time, stay active, stay informed, and remember that your health is your greatest wealth. This is Dr. Emily Carter signing off. Sometimes the answer to chronic pain isn't another stretch or another pill. Sometimes it's a simple nutrient your body has been missing all along. Disclaimer: this video is for educational purposes only and not medical advice. Always consult your healthcare provider before starting any new supplement regimen, especially at higher doses. And if you have severe or worsening sciatica, seek medical evaluation to rule out serious conditions.